Next is endolaser photocoagulation. Here we should understand now treatment is also directed towards a more inner layer of the eye, which is a retina. Here coming to retina, we all know the image falls on the retina. Now we all know the image falls on the retina, and retina is in two layers. One as a sensory layer and then as a nervous layer, right? So what happens here is, in order to treat conditions like retinitis, they can do a endolaser photocoagulation via laser or any light waves. The physician is going to coagulate, which is nothing but to destroy the particular organ. Next is like pan-retinal photocoagulation. The entirety of the retina is now being treated. Say macular pucker. What happens? Macula is that's a site for color vision. So here scar tissues are formed. Okay, so in order to treat that macular pucker, they are passing laser waves. Next we have like retinal detachment. What is this detachment? Where does this retina get detached? So we all know like there are two layers. Separation of the sensory from the nervous layer is called as retinal detachment. This can be two ways, as partial or complete. If there is a case of a complete detachment, what happens? This would result in blindness.